It's my pleasure today to introduce Alem. A lot of us know him here in the department. He's a second-year PhD student in the Department of Pharmacy Systems, Outcomes, and Policy. A lot of us have worked with him either as a TA or doing research. He came to us last year from Ethiopia, from Addis Ababa University. He did his Bachelor of Pharmacy there and his Master of Science in Pharmacy Practice. A lot of the research that he's done here at UIC has had to do with cancer patients, specifically multiple myeloma, looking at epidemiology and some cancer outcomes. And today he's going to be talking about patient-reported barriers to medication adherence and also censored medication devices. So take it away, Alan.
All right, thank you. Thank you everyone for coming. This study is centered around patients that are getting their multiple myeloma treatment at UI Health Clinic. So we want to try to identify what factors are there regarding medication adherence and their perspective towards censored medication devices. So I will go ahead and start my slides by showing you a quote that was taken from a study that says, increasing the effectiveness of adherence interventions may have a far greater impact on the health of the population than any improvement in specific medical treatment. I feel like this statement kind of places the importance of adherence in patient treatment. So saying that, but as you all know, there's a problem with adherence. Not all patients are adherent to their treatments. So because of that, there can be an increased case of mortality, morbidity, as well as increased cost. The WHO puts, this is a very commonly used figure, the 50% figure. It is the level of adherence that was put forward by WHO regarding chronic medication use for chronic disease management. Now, when we come to cancer treatment, now the idea of orally administered medications are increasingly becoming part of cancer treatment. More recently, there are new products being introduced into the market. The trend is expected to continue this way, with one study putting the 25% number on the drugs in the pipeline for cancer treatment. This was a study that was published in 2010. The number will be probably will be higher now, and the number of approved drugs on the market was estimated to be above 50. Now, the transformation to oral medications have its own benefits and challenges. So in terms of benefits, it can increase patient preference. So patients may want to take their medication at home. It kind of skips the complications of intravenous administration. As you all know, it's an invasive way of administration. So the transformation to oral medications kind of overcomes that problem for some group of patients. It can have a favorable pharmacokinetic advantage. There can be associated cost reduction. Again, it can be on both ways. Some of these newly approved oral anti-cancer medications are very expensive, so they may end up being more expensive in some aspects of it. But it can also bring this new challenge to patients. Now, you always have heard about people talking about patient burden, and I want to give some time on that and try to describe what do we mean by that. So these patients, as you all know, we are working on multiple myeloma, so they are cancer patients. So in addition to that, when we move the treatment to orally administered medications, now it becomes clear that the administration role will be shifted to the patient. There is a filling of prescriptions, additional responsibility. They also have to do side effect monitoring by themselves, to some extent that is, and they also have to manage taking their drug medications. So it's like these patients they are mostly older patients. Most of them may have other comorbidities. So the challenge of having to deal with these new medications have a higher impact on this group of populations. By all this, it leads to a decrease in medication adherence. So this all impacts medication adherence. Concerning adherence to oral medications, a few studies were located. Somewhat recent review, it was done in 2016. It puts the number ranging from 46% to 100%. But now the problem is the way they defined adherence, their cutoff point, the patient population they used, the cancer type involved were all different. So the diversity in results kind of corresponds to those factors. But you can see that there's some sort of suboptimal medication adherence. When we come to blood cancers in general, another review looked at hematological cancers particularly, mainly chronic myeloid leukemia, and they put the numbers between 76 to 98%. So you can still see there's a gap in between. So why multiple myeloma then? Why do we need to focus this study on this group of patients? The approval of oral medications is significant in this type of cancer. As you can see, thalidomide and its more recent derivatives, they are orally administered. In general, the treatment is more complex with weekly, bi-weekly, or every other day administration. In addition to the cancer treatment, they also receive other supportive therapies, such as acyclovir antiviral treatments, anticoagulation treatment, and supplements such as calcium. There is the effect of age and age-related comorbidities. So you can tell that the idea of adherence to medications in this group of patients is somewhat complicated. There are so many variables. Now, where are we now? Like, what's the idea behind this research? So at the start, at this point, we are trying to identify patient-reported barriers, as well as their perspective towards censored medication devices. Now, the long-term goal is like having this idea will help us to design a study, more specifically an intervention type of study that may end up improving the adherence in this group of patients. So this is the initial phase of the study, like the start. So why these devices then? Now, you may have seen it like in the news or in other articles, the idea of censored medication devices. Like it can be electronic bottles, it could be a pill box or other devices that are aimed at helping patients to adhere. So they work by giving out reminders to patients, which can help them to improve their adherence. So there are audio-visual aids. For example, they can give like sound signals or lighting signals at the time of like when they are supposed to take their medications. They can also be coupled with short messaging services, SMS. So these devices can be helpful for a group of patients that have a problem remembering to take their medications. So that's one advantage of them. What's unique about this study, I think, is we are trying to use these devices as a way to gather information to identify the barriers related to adherence. So what some of these devices have the ability to capture and record information regarding the opening of the devices. And another one even gives a real-time monitoring of the medication taking behavior of patients. So we are aiming to use this SMDs as a tool to gather information so that we are able to identify factors that are responsible for non-adherence and designing an intervention aimed at solving those adherences. Questions? Okay. So before going ahead with like giving the SMDs and trying to identify these barriers, possible barriers, first we need to know what do these patients think about these devices in the first place? Will they be willing to use them at the first place? So the acceptability of such devices with real-time data transmission is not yet known, specifically in lower socioeconomic background and minority population, who are placed at a high risk of non-adherence by several studies. So first we need to capture this information before going ahead with the intervention or the design of the study. So the study was aimed at first identifying patient-reported barriers to medication adherence. The second aim is to identify or to understand a patient's perspective towards SMDs. So information collected from this study will be used to inform the design of a future study. So the study was informed by a theoretical model that was developed by the World Health Organization regarding factors affecting adherence. As you can see from the picture, they call them the 5 dimensions of medication adherence. So there is the health system and healthcare team factor. There is the social and economic factors. There is a condition-related factors. There is a therapy-related factor. And the patient-related factors. So these 5 dimensions. They kind of classified them into 5 categories. So what was the method used for this study? It was an in-person, semi-structured, qualitative interview, which was conducted using a convenience sample of patients being treated for multiple myeloma. It was conducted in UIC Cancer Center on patients that were presenting for a regular scheduled appointment for their treatment. Our inclusion criteria is patients that were 18 years and older. They have a diagnosis of multiple myeloma, of course. They were receiving oral anti-cancer medications, at least for the past 3 months, and they spoke English because the interview was conducted. Coming to the recruitment process, the research assistant spoke with the oncologist, the on-site oncologist, Dr. Patel, and 2 other oncology pharmacists to identify scheduled patients that qualify for the study. So once they are identified, they were approached by the research assistants, and they were taken to a private room, and the overall goal of the study were explained to them, and their willingness was first asked before the start of the interview. So once they were willing to participate in the study, the interview started, and all interviews were audio recorded. Now, the censored medication devices that were shown to the patients in this study were these 2 devices. So the first one is the MEMS cap bottle, and the second one is the smart bottle. So these were chosen because they were the ones that were accessible to the research team. So the research team tried to get as many devices as possible to show them to the patients, but only these 2 were accessible at the time of the study. So these were shown to the patients. So coming to the interview questions ranged from the level of technology or comfort engagement, health condition before multiple myeloma diagnosis, their experience if they were taking chronic medications prior to their diagnosis. So how was their experience with medication taking? How do they organize their medications at home? If they get any assistance from anyone. And in addition, they were asked if there are any factors they can recall that helped or hindered them from taking their medications. The second part of the interview shifted to the second aim of the study, that is explanation about the use and the mechanism of the censored medication devices were explained to the patients, and their perspective towards the devices were asked through the interview. The coding process. So as I said earlier, the interviews were audio recorded. So the next step was to transcribe the audio record. So they were transcribed prior to the coding process. The transcripts were reviewed by the team to assess for thematic saturation. As you know, in qualitative study, you are getting a lot of information. So the saturation level was checked, and the demographic characteristics of respondents were kind of evaluated to check for that one. Coming to the transcripts, after going through the first few transcripts, a comprehensive coding scheme was developed, and it was used to transcribe all of the remaining interviews. I want to show you this picture. You cannot read what's on it, but it's the Excel file. It's like how the coding was done. So as you can see, each column corresponds to a question and another like comment associated with the question, and each row corresponds to each patient. So the information that was gained from the interview were taken part by part, and it was subdivided into the different questions on the interview. So it kind of enables you to get all the information in the same place. And it's nice to when you move into the write-up process and everything. So in our interview, 20 patients were included, and the interview lasted from 20 minutes to 40 minutes. I want to include this table to show you the demographics of the patients included in the study. It's a small sample, but you can see the diversity in there. So including the insurance types we have in there, the age, we have 29 to 71-year-old patients, the marital status, and other information. And from this table, you can see that the characteristics we are having here is kind of reflective of the patients that get service at UI Health. Now, let me go into the questions and the answer given by patients. So coming to the comfort with and use of technology, over half of the patients described themselves as having some degree of comfort, and those that were less comfortable with technology, they say, one patient said, I'm completely versed as technology is concerned, but I'm fascinated by technology. And the other one said, I'm not savvy in that technology. I'm more computer literate than with the telephone. So they were asked if they had a smartphone. So this was their response. When it comes to cell phone ownership, most of them have like smartphones, but 2 patients reported having basic phones that were not internet enabled. Interestingly, one person who said or reported having a smartphone stated, I feel comfortable using the internet. I don't like apps. I don't do text messaging at all. Not interested at all. I would rather talk to somebody. I can talk much easier than I can type. So it kind of gives you like, some patients may have the technology, they may own the technology, but they may not know how to use them, or they may not be like interested in using them. So ownership doesn't always translate to it, like knowing how to use stuff or technology. Coming to their prior health and medications, 12 patients described their health as being very good prior to their cancer diagnosis, and the remaining 8 have some other chronic diseases, including hypertension and diabetes. In terms of medications, patients in the study reported taking multiple medications. It ranges from 3 to 24, having an average of 13. And because of this, the next question posed to them was, do you think your cancer meds were more important than other medications? So their response was 6 of them said their cancer meds were important. Or do you feel, I think the question was, do you feel any of your medications are more important than others, rather than specifically saying cancer meds are more important? So their response was, the cancer medicine is the most important by far because I have cancer. Some of the other I could take every other day or not at all. It wouldn't matter. But generally, there's an understanding that all of their medications are important for them. And one example was they are all very important to me. I had a heart attack, so that has solidified and strengthened my belief that my hypertension medication is just as important as my cancer medication. Now, coming to the barriers to medication adherence, 70% of them openly admitted that they have failed to take their cancer meds at some point. they offered important insights into the reasons why they were not taking their medications. So they have mentioned being fatigued, having a busy schedule, forgetting, or intentionally missing doses also was one of the factors. So we can categorize this as patient-related factors. As you remember, that is one of the domains that was placed in the theoretical model that I showed earlier. Coming to the social and economic factors, the positive impact of social support was evident by many patients. As one patient puts it, yeah, if I forget, my kids will ask me if I took my medicine. I tell my son to tell me if I haven't taken my medicine, but sometimes still I get tired and may forget. So the social impact, the social support was there for some of the patients. But another response was some patients want to keep their cancer private to them. They don't want anyone to know about it. And concerns that taking their pills outside of the house may call on attention to them. And the youngest patient in our interview said he missed doses when he was partying. So when I'm forgetting is when I'm kicking with my homies, and I forget because I don't want to carry the bag with my homies. I did forget because I was getting high and I would not be around my meds. I would be somewhere else. Sometimes the police officer, if they do not see them in the bottle, they could charge you. This is like very important point, and kind of shows you the type of barriers that are unique to some section of multiple myeloma patients. So the barriers are diverse, and for example, talking about SMDs under such kind of scenarios may not solve the problem. So that's the whole point of using SMDs, to identify some of these barriers to develop an intervention tool. One important thing about this patient population, particularly at UI Health, was no one endorsed experiencing a financial barrier when it comes to their medications. So this is likely unique to the study setting because of financial assistance programs that exist. And most patients reported paying nothing or having to pay very small copays. Another adherence dimension that we have looked at is therapy-related factors. So patients said some of the reasons or some of additional reasons they were not taking their medications include experiencing side effects, difficulty swallowing large pills, and regimens that include a large number of pills. And one patient that was that reported that that was intentionally missing doses was due to such type of factors. What about the healthcare team and system-related factors then? 4 patients mentioned that refilling medications was sometimes delayed due to miscommunication. Their response was sometimes the medications get pushed back because of delivery or insurance. And the other one said, I think the pharmacists get their wires crossed and have to figure out where my medications are at. Sometimes the doctor hasn't sent the prescription in, or the pharmacy hasn't received it. But still, there were a group of patients that were 100% adherent. So when they were asked if they have missed their medications previously, few patients said no. So their response was, no, of course not. I'm retired. I have a lot of time. I take most of my pills in the morning, and that's it. And another one said, no, oh no, I do it faithfully. I'm going to be honest. If you want me to continue living, you have to take the pill. So going into the second part, it was aimed at the questions were aimed at finding out the perspective towards the devices they were shown. So prior to these questions, they were shown the devices. It was explained to them how they work. So after showing them, they provided us with a range of responses, from positive to complete lack of interest. So the yes group said it would be pretty cool. You would look forward to taking your medications then. And another one said, these are amazing. Whichever one gives a more accurate description of what's going on, I would be happy to use it. On the no group, it would bother me to see the extra bottle. I don't like seeing the medication bottles out of sight, out of mind. A big pill bottle would grab more attention. And another one said, no, I don't want that thing talking to me. So they were told about the text messaging service. So I think they kind of took that as another other something in their life, I guess. So, but once they said I'm okay, I don't need this, I'm okay, and everything. But they suggested it would be useful for others. So they were just others may want this, they would love this, something like that. So their response was, that's probably a good idea for some people, but I do remember pretty well to take my medicine. Another one said, if someone was forgetful or not organized or had dementia, maybe it would be useful, but it wouldn't be useful for me. And another one said, I have a great system already, but if their doctor suggested for them to use it, they would give it a try. So that was their response. After knowing if they like it or not, the second or the next question was, all right, what are your concerns towards this device? What questions do you have? So they said the first one was privacy issue. So the monitoring thing kind of gives them a bad feeling about it. So they say they have privacy issue concerns. Some asked about child proofing. Another one asked for arthritis patients, it may be difficult to open. Potential added cost. I feel like that's usually overlooked. There's a new technology. It can help patients, but patients think about the added cost of it. So that was the first thing that came into my mind with one of the patients. Some didn't want to carry another bottle with them. So these were the concerns, especially during traveling. So patients may want to take 1 or 2 pills just for the length of their travel. But these devices have the capability to record the medication that was taken out of the pill bottles in terms of weighing the pills inside the bottle. So that can give a false alarm to their healthcare team, and they were concerned about that. So their example responses were, I don't mind it counting the pills, but when the doctor can see what I'm doing, and if I'm doing it right, even though it's for a good reason, that's pushing it for me. It starts to get a little invasive. And another one said, well, to me, it seems to be an invasion of privacy. It seems like it's making a simple thing quite complicated. It seems to be too much. It seems to be much too much regulation. Overall, despite the concerns or doubts about these devices, when asked if they were interested in using these devices in the future, 60% said they are interested in trying them out in the future. So based on this overall assumption, I just want to summarize the results in 2 bullets. So a range of factors have been identified as barriers to medication adherence with this group of patients. And of course, they have also reported missing at least one of their medications at some point. And given the positive perspective expressed towards these devices in the majority of patients, we believe individuals from a lower socioeconomic and ethnic minority will be interested to be included in future efforts using these devices. So what's the next step? As I showed you earlier, we are at a starting point identifying barriers to medication adherence and perspective towards these devices. So the next step will be giving these devices to the patients. As you all know, people usually, there is a difference between what people say and what they actually are willing to do. So even if some said yes or no in their responses, when they were actually presented with the opportunity to use them, some may refuse to use it, others may want to use it. So that will be our next step. So coming to the limitations, It's a small convenient sample of multiple myeloma patients at a single minority serving academic institution. So you can see some of the limitations there. Patients were established with their providers and had been in care for many months. Financial barriers were not a major issue for this group of patients, but it was identified by other studies as one of the factors for medication adherence. I want to thank Dr. Lisa Sharp for her continuous help and giving me the opportunity to work on this project. I would also like to thank the team at the Cancer Center here at UI Health, Dr. Patel, he's the oncologist there. We have oncology pharmacists, Dr. Swayze and Dr. Ward. Dr. Connie Yan, she was one of the coders on the study. Mr. Victor Ramirez, he was the one that did the interviews. I would like to thank the study participants, UI Health, and the UIC College of Pharmacy for this study, and thank you.